Hi everyone. Welcome to the first of the speaker series of the AOP's mentorship program. We have participants across continents for today's session. So good morning, good afternoon, and good evening. Today's speaker is Dr. Joseph Cohen, known to many as Rich. He has lots of knowledge and a rich experience in the field of orofacial pain to share. You may have seen a short blurb of his resume actually when, registering for this webinar.
So the goals to today is we want to open your minds to the concept of orthopedics, entering TMD, and how dentists really are considered the orthopedists of this area, and how to think more medically than dentally with doing these things. We'll present evidence for the uses of orthopedic appliances. I'll talk about my clinical experience and review the use of appliances in other joints to show that what is orthopedics and how our specific diagnosis is used in other fields, instead of just an idea, oh, you have TMD, let's make an appliance for you. It's a lot more complex than that. And in my work over the years in reviewing programs and being a mentor, there are a lot of dentists who use appliances as a one use only. You make a flat plane appliance, and that's supposed to treat every kind of disorder of joints, ligaments, muscles. And that's just not how orthopedics works outside of dentistry and all the other joints. And we'll be going over that. I'll talk a little bit about the true definition of evidence-based dentistry, which does broaden the idea of what we do clinically actually fits into evidence-based dentistry. And it's very important, since some of the issues I'm going to discuss are my opinions, and I feel I'm going to present good evidence for it, but there's a lot of opinions out there. And I think one of the main benefits of this presentation should be challenging whatever I say or asking questions about it. And that's how we all learn, is by the freedom to be able to challenge other people's views. And I'm certainly open to that. So this lecture will be based on clear evidence-based research and defining then what evidence-based is, like what are best practices. A best practice is defined as a program, activity, or strategy that has been shown to work effectively and produce successful outcomes, and is supported to have some degree by subjective and objective data sources. So these are usually based on clinical experience that has no clear evidence for or against, so falls in the category which qualifies for evidence-based if there's no clear evidence either way. This means that the benefits outweigh the risks, and is generally supported by existing data that may not qualify as like a randomized clinical trials and a systematic review of randomized clinical trials, which is the highest form of evidence. So there are research that you can look up to say what are these research that support what I'm just saying, and I'm listed here. That there are many published definitions of evidence-based medicine that clearly state that when there are no clear high-level evidence for or against something, then the evidence-based, which is still considered evidence-based, is your clinical experience that meets the definition of where the benefit outweighs the risk, and there's some evidence in the literature to support it. So keep in mind that if you look up the definition of evidence-based, it's not just literature, it's a combination of clinical and literature. So that's very important, because a lot of what we do in dentistry is based on things that aren't perfectly evidence-based. Otherwise, you wouldn't be able to do a lot of things that you do. And this is in medicine. Every field has developed these guidelines to allow you to do things clinically that don't have a lot of literature support.